Okay. So let's talk about soft tissue neoplasms around the lumbar spine today. Uh, so we've already talked about other lumbar disease processes. So, and this will just be a potpourri, and these will be kind of arbitrarily placed here. They're not quite as well organized as the last couple of show and tells that we did. So why don't we start here, and Brian, why don't you take this one?
There's an expansile, looks like a fluid attenuation lesion in the pelvis, or in that, sorry, pelvis, the sacral canal with smooth scalloping in the bones, looks chronic. So I think it's Tarlov cyst.
Tarlov cyst, and it's most of these that I found, even the large ones like this, it's controversial as to whether these actually produce pain or not, and whether decompressing them actually help the pain. Okay, Pratima? Can you turn your mic up a little bit?
Two sagittal images of the lumbar spine. There is another expansile lesion in the lower thoracic cord, lower thoracic spinal canal, which extends out to the neuroforamina. I would like to give contrast to see if there's any enhancement. Okay.
Yeah, we don't have a contrast, though. It would not enhance, and this was an arachnoid cyst. Okay, Philip?
Okay. So it looks like there's another cystic mass in the region posterior to the thoracolumbar junction in the subarticular and foraminal zone without enhancement. I think, is that a postcad? No, maybe not. No, that's not. Yeah, so arachnoid cyst.
And here's just a cyst adjacent to the nerve roots going into, as we've seen, just a nerve root sheath cyst extending out along the nerve root. Okay, Brian?
Hey, abdominal pain, 38-year-old male, lobulated fluid signal mass. It looks somewhat like the arachnoid cyst. I guess it could be a lower.
Yeah, there's a lot of scalloping of the posterior vertebral bodies here. It does go out in through the neuroforamina. Some septa in it, and that was also a large arachnoid cyst. Pratima?
Soft tissues of the sacrum, there is a mass lesion which demonstrates enhancement. A 39-year-old male patient. Okay. And is there, so low on T1, right on T2, it looks pretty cystic.
But you said it enhanced.
Right, I thought so, but was that an enhanced image for sure, or was I mixing it up?
Yeah, I think this is, well, it's hard to say because we don't have a T1 fat set pre. I think that's a T1 fat set post. So without having both a pre and a post, we can't really reliably talk about enhancement, so we don't really know. But it probably did enhance. This is a dermatofibrosarcoma protuberans, and not a real common lesion, but it's a tumor of the skin that needs to be differentiated from a melanoma. Sometimes the T1 weighted images, if you see bright signal on a, or fairly bright signal on a T1 weighted image, that's a little bit more of an indication that you might have melanin in it. Okay. Philip?
Okay, so we have a T1 ISO, T2 hyper, and looks like a stir hyperintense mass within the subcutaneous tissues adjacent to the posterior fascia. So it looks like there's some internal. Yeah.
But there's a little bit of a straining around it.
Yeah.
Like that.
So let's see. So it looks like it's solid. I mean, I'd be worried about like a sarcoma or.
Yeah.
Okay.
This turned out all to
fibrosis.
be all fibrous tissue, just aggressive fibromatosis. But I think you wouldn't be able to reliably say that, so it's something that has to be biopsied with the concern of malignancy. Let's see. Hi, Eric.
Hello, everybody.
Good. Well, we just started talking a little bit about soft tissue masses around the lumbar spine. Why don't you go ahead and take this one?
Okay, that's a 1-month-old female. CT images showing some low-density areas, soft tissue superficially posterolateral to the sacrococcygeal region, possibly cysts. Yeah, looks quite cystic on the MR. So this could be a type of pseudomeningocele, or there's some enhancement though on the post contrast, possibly with some solid components. Could be a sacrococcygeal teratoma.
Good. Yep. Brian?
All right, back pain, 59-year-old. Okay, well, there's a, looks like a periamplified mass around the proximal right ureter. So, kind of extends over the pelvis, so, it could be a calculus and it's dark. Yeah.
Yeah, just remember other things can cause back pain, and occasionally you can find them on an MR. You just have to be sure and look at the retroperitoneal tissues. Pratima? We can't hear you.
So like to get contrast and see if there's something that enhances. So we have contrast enhanced images, post.
Again, I just like to just have say for the 10,000th time this year, it's very important that the pre and the post be the same. You really can't tell whether there's any enhancement here at all, because as I've shown you repeatedly, T1 weighted fat SAT images in a lot of tissues, the tissues can look very bright even when there's no enhancement. So, but so we really don't know. Maybe there's some enhancement here.
Right. So an extradural mass could be mets.
Wait, you think this is outside? Okay, you think it's outside the dura? Wait.
Well, it's outside the cord. It could be extradural or intradural.
Are you talking about this?
Yeah. Yeah.
Oh. Okay. Well, but look at the conus here. This was an AVM of the conus, and if we come back here, you can see a little bit of vascular structures here, which are a little bit subtle, but you see a widening of the conus and increased signal intensity within the conus. Maybe a little bit of a dilation of the central canal more proximally. And looks like there's some vascular flow down here of some vessels intradurally there. And these may be related to the AVM. So this is actually an AVM that was involving the cord, causing ischemia of the cord and expansion of the cord, of the conus. Okay.
So these are elderly male with Babinski sign, abnormal gait. So there are a lot of vessels surrounding the cord. There's also expansion and increased signal of the lower cord. So I guess be worried about like a dural AVM or AVF with ischemia. Surgery with feeders tied up.
Okay, and here we're just getting a lot of indistinctness of the conus down here. And that also is an AVM. They can be fairly subtle.
Mm.
So it's a signal intensity and abnormal size of the conus. You have to be concerned, and then look for the vessels as you described in the area. Okay, Eric.
Okay, 61-year-old female back pain after motor vehicle trauma. Let's see, sagittal images T1, T2. There's an area of abnormal signal in S1 posterior superior. This could be some type of vascular anomaly. There's some enhancement on that. Oh, that's T2. There's some possible flow void, I guess, as
Yeah,
well.
I think that's flow changes, a lot of atrophy too, but I think that we can see that there's a kind of an extrinsic erosion of the S1 here posteriorly, and it looks like some flow and an enlarged structure there. And here we can see.
You can still see the flow void post-GAD and also some enhancements. This could be a AVM or some type of...
Yeah, this was actually an epidural aneurysm. So, something you see every day. So, Brian.
Right, there's a heterogeneous mass in the sacral canal between S1 and S2. It's got areas of low signal. Can't tell if there's enhancement or not. Not 100% sure. 10 years. So I think in this location could be mixed papillary Lymphoma, drop metastasis. Doesn't obviously enhance, so I would expect it to if it was one of those.
Turned out to be an epidermoid cyst. Pratima?
Okay, 45-year-old with back and buttock pain for 6 months. So there is a heterogeneous mass in the lower lumbar sacral canal that
Very sharp margins.
very sharp margins, right? This is definitely extramedullary. So this could be again a
Shoot. Okay, so this was an epidermoid cyst also. But, you also have to be concerned about a schwannoma. But that was an epidermoid cyst with kind of a complex nature. There's another one. Oops, I'm sorry. Shoot. Yeah, well, so this one we can see that there's a big mass here. In this particular case, this patient has neurofibromatosis. We can see it's really kind of a long mass with irregular margins, and it was a plexiform neurofibroma. Philip?
So right foot pain and swelling for 10 days after incisional biopsy. So there's a lot of soft tissue swelling around the forefoot. So
There's a central necrosis.
yeah, soft tissue mass surrounding the metatarsals, and then we do not know if it enhances. But after
so there's not a lot of enhancement.
so I'd be still like a soft tissue sarcoma. There's stuff in the posterior knee too, so there are multiple skin masses. Then maybe the neurofibroma. Yeah, another mass there.
So those are all neurofibroma.
Mm.
Between neurofibroma and certain findings that they're not all that helpful, I don't find. So MR is helpful in different diagnosis, but there's no, it's like so many things with MR and masses, there's really nothing that's really definitive in terms of making the differential. Okay, Eric.
This is sagittal lumbar, multiple nodules on the cauda. And we don't have a post-GAD, but it certainly have a solid appearance.
Why don't you assume they enhance?
And assume they enhance. These could be drop metastases, could be hemangioblasts. Is it hemangioblastomas? It also could be
Yeah,
peripheral.
this is probably a little old patient, I guess, for hemangioblastoma, but
Mm-hmm.
yeah.
Could be neurofibromas or nerve sheath tumors or
Yeah, here you can
neurofibromatosis.
see.
Again, with some widening and some dural ectasia. And
Yeah, it enhances.
yeah, there's some enhancement.
Probably enhancement. So that was neurofibromas. This was the NF type 2, which tends to involve more peripheral tumors. Okay. Brian?
Changes in the lateral spine radiograph are smooth, I think it's expansion of the undersurface of the pedicle around 2. Sclerotic margin there. Soft degenerative changes all the way down. So something that's widening the foramen and then confirmed on MRI. So it could be a peripheral nerve sheath tumor.
Yeah, another neurofibroma in this case. Pratima?
Okay. MRI of the lumbar spine demonstrates a mass in one of the neuroforaminas, I think 5432L2. That's causing expansion of the neuroforamina again. So yeah.
That's another neuroma. Yeah, schwannoma versus neuroma, right. Philip?
So there's a mass causing scalloping along the posterior aspect of L5. Kind of hard to place it. It looks like it might be extradural. And it's got kind of maybe a central dot sign or something. Target sign. So yeah.
First
think
target sign.
a peripheral nerve sheath tumor.
Yeah, schwannomas, the target sign, they tend to be a little bit lower in signal intensity on the T2 centrally. Okay, Eric?
This is another enhancing soft tissue mass in the cauda, also possibly a neuroma nerve sheath tumor.
I guess I have a little few too many neuromas here. Okay, Brian?
All right, there's a mass in the left psoas muscle. It's fairly well, it's kind of either displacing it or within the psoas muscle. It's heterogeneous. The patient's anticoagulated. I guess could be hemorrhage, especially if it's acute. Nerve sheath tumor. Actually, it looks like it's on a nerve. So yeah, it looks like a nerve sheath tumor here.
Kind of fat split sign, which I think is probably not very specific, but it suggests schwannoma, which is what this was. Okay, Pratima?
Okay, so CT scan images on the top and MRI on the bottom demonstrates a large mass centered in the left sacral area, which is destroying the bone. Very heterogeneous on MRI, extending into the epidural space. So again, this could be an aggressive nerve sheath tumor.
Yeah. Okay.
It's a large heterogeneous mass extending into the bone there in the left neuroforamina. Solid. That has central hypointensity. It's kind of heterogeneous. And
So it looks like it's been there a long time.
Yeah.
The bones remodeled around it, so what do you think it is?
a peripheral nerve sheath tumor.
Schwannoma, yeah. So it can look like a lot of things. All right, Eric.
58-year-old male, low back pain, both legs, to the radiating 5 months erectile dysfunction, urinary incontinence. So there's a large, at least partially cystic appearing, but also peripherally enhancing, multilobulated mass, possibly some fluid levels, and just filling the canal spinal canal, you'd think about a myxopapillary ependymoma with its heterogeneous
I don't know.
features.
I don't know how frequently you see fluid levels in those.
Mm-hmm.
I don't
It could
remember
be
seeing one.
it could be an abscess, but
This patient also had some lesions elsewhere.
so it could be a drop, well, drop metastases or ependymomas can be in multiple locations
Yep.
like this.
This probably looks extradural,
Mm-hmm.
and
That's true.
these turned out to be schwannomas.
Okay.
And until I saw this case, I hadn't realized that schwannomas can have fluid levels in them, but it's listed as one of the tumors which can have fluid levels within them. So,
It's because of the necrosis or something.
I suppose hemorrhagic necrosis. Yeah. Okay. Brian?
Okay, there's a heterogeneous mass, just next to the conus. It's got a fluid signal, and it's got some solid carrying components as well, with enhancement. So this could be, again, metastatic disease. I guess this could be schwannomas too. Yeah?
Yeah, this was multiple schwannomas. Pratima?
Okay.
Forget the disc disease.
53-year-old with low back pain for 5 years. So on the second sagittal image, there is these nodular densities seen in the cauda equina, pretty small, which are enhancing. So these could be again same thing, small schwannomas versus drop mets.
Yep, these are, again, multiple schwannomas. Neurofibromas. Okay. Philip?
So, lesion, it looks like there might be something, an intradural mass displacing the cord anteriorly. And it's, looks like it's extradural. It's an extradural mass. I mean,
It very much looks like it's based is against the dura.
yeah. I mean, it doesn't quite look like a synovial cyst.
It looks like cord tissue in all sequences. If we gave enhancement, it would enhance.
A meningioma.
So it's
Okay.
meningioma.
Oh, so it looks so obtuse. I guess.
Yeah, it's
I'm
really
elongated.
based here
Okay.
against the dura and then kind of extending inward.
I see. Okay.
Just a little bit elongated because of the location it's in.
Mm.
All right, Eric.
Sagittal lumbar, there's a mass near the conus, or in the conus, your immediate signal intensity looks to have some solid components, probably enhances. But on this view, it does look well defined, maybe extramedullary, and again, could be a meningioma. It's well defined. It's hard to say without an axial exactly what it's doing to the cord, but it
Yeah.
may be compressing to the right there.
Typically, meningiomas will tail against the dura, like we saw that last meningioma do. This one seems to have an obtuse margin when you get to the dura, which would be a bit atypical. This was a maxillopapillary ependymoma, and these often look very exophytic. Sometimes they can look like they're really within the tissues, and of course this is down probably at the conus, and it's probably involving maybe one of the nerve roots coming off the conus. Okay, Brian?
All right, there's a lateral radiograph of the lumbar so far, and we have a fairly well defined mass in the spinal canal. Which could be mixed metabolic adenoma, could be paraganglioma, could be peripheral sheath tumor. I don't see anything here that would be anything. Maybe
Oops.
on the base component.
Wait a second here. It looks like we're going to a different case here. Sorry about that. Let me just see. Yeah, that was a maxillopapillary ependymoma. And this study is from a different case. So I'll have to go figure that out later. Okay, maxillopapillary ependymomas, fairly common lesion. Intradural extramedullary tumor of the spine. These are the ones to think about. They kind of have characteristic shapes. Okay, Pratima?
Sagittal image of the spine demonstrates a extramedullary mass in the posterior aspect of the canal, which is pretty bright on this T1 weighted image. Considering the signal intensity, this could be hemorrhage or a fatty lesion. I'd like to see more images. Okay. So on the T2, it's hyperintense as well. And there it is. So very bright. Could be a lipoma.
Yeah, that's a lipoma. Yeah, typically I found where in the brain sometimes hematomas can be very bright like this. That's pretty uncommon in the musculoskeletal system. Usually they have more of a mixed appearance. Though certainly a hematoma would have to be on the differential here, but I haven't found them to have this kind of a bright appearance uniformly very often in the musculoskeletal system.
So we have numerous axial images demonstrating there's like prominent epidural fat with compression of the central cord and fatty. So sagittal images demonstrate a lot of epidural fat, so yeah, epidural lipomatosis.
Okay, Eric?
A 67-year-old female back pain, also permanent epidural fat at DL2 level, also O1, O3, and seems to be
Notice
exerting
that
some
both of these patients have tremendous fatty atrophy of the erecting muscles. Yeah. And this turned out to be an angiolipoma. So this one was very vascular. Okay, Brian?
Okay, 22-year-old black and eye pain. You see around mass, which was hyperintense on T2, and looks like it is enhancing. So we have the same differentials we've had before in the lymphoma, ganglioma.
So this was a hemangioma. And the previous lesion was probably kind of just a very fatty hemangioma. And the differential, any other mass lesion that can be in that location. Okay. Yeah, go ahead, Pratima.
The sagittal images of the spine demonstrate a low T1 and a extramedullary mass in the spinal canal there, which is bright on T1 and intermediate on T2 images. So again, same differential
Yep.
of a schwannoma versus meningioma or hemangioma.
Here are just others.
Regions.
And these are all drop mets. There's another one. Okay.
Yeah, lung cancer with brain mets. There's a lot of intradural intramedullary masses kind of sugarcoating the caudate equina. So, given the history of primary malignancy, this is drop mets until, yeah.
That's all over the place. Eric.
77-year-old male status was discectomy 8 years ago. Low back pain rate in both legs of 2 years duration. Aggravated 6 months ago. And there's a mass in the posterior, in and near the posterior elements of S1. Some heterogeneity. And I'm not sure if we have a GAD here, if there's enhancements.
Yeah, I don't think
But,
so.
Maybe a little bit. And it seems to be centered in the paraspinal muscles, actually mainly in the soft tissues, with possibly some calcification, or I don't know if that's enhancement. And bone windows.
Textile.
Not on my list.
So that's basically a foreign body reaction. And I forgot what fabric was left in the body in this person, but it was probably some sort of a sponge or cotton from the surgery that was left in and was removed, and they found it in the surgical specimen. Okay, Brian?
Okay, there's a mass which is high on T1, kind of ISO on T2, and right on the fence. It's scalloping. It's been there a while. It's got some central cystic component.
Yeah.
Let me guess.
It's turned out to be lymphoma.
Okay. Axial images of the spine demonstrate a large mass in the left paraspinal muscles that is also extending into the neurofibromas and involving the transverse process. And there's another one on the other side. And the bone marrow, I don't know if that signal is within normal limits or not.
Probably not.
Probably not. Okay, so this is lymphoma probably.
Yeah.
So the sagittal images demonstrating numerous retroaortic lymph node or periaortic lymph nodes. Looks like questioning a soft tissue mass posterior in the region of the ligamentum flavum, kind of at 3-4 posteriorly. There's a lot of retroperitoneal adenopathy. Okay.
Eric?
Sagittal and axial lumbar images showing they're showing some soft tissue fullness in the retroperitoneum as well, and also I think possibly an aneurysm of the anomaly aorta.
Yeah, just to remember to look at the retroperitoneal tissues when you do an MR. And I really don't like it when some people will just cone down the axial images so you only see the cord. I mean, you only see the vertebral bodies. But I think it's critically important to evaluate the muscles because I think they're often a cause of symptoms, as you all know. So I think you should always grade the level of atrophy of the spinae erecti muscles, especially now since we know that exercise programs are probably more effective most of the time than surgery is for a lot of degenerative back disease symptoms. But also, I really think we need to evaluate for abdominal aortic aneurysms as a cause of back pain and the other potential causes of back pain that we've seen here. So I think it's important to always, at the end of your scanning of the images on the lumbar spine, to always go through the retroperitoneum. Okay, Brian?
Right, there's a well circumscribed mass, possibly cystic in the subcutaneous fat right beneath the skin. Very suspect location for an epidermal occlusion cyst or a suspicious cyst.
Yeah, this just turned out to be a sebaceous subcutaneous cyst. Pratima?
51-year-old with a coccygeal mass. So the images demonstrate a mass that is centered in the coccyx, arising anteriorly and going posteriorly, which appears solid on the ultrasound images. Looks like it will. Okay. So, low on T1 and high on T2, fairly large in a 51-year-old.
Yeah, let me just go back here again. Yeah, there's a lot of echogenicity in it, okay?
Right, right.
Yeah, this turned out to be an epidermal cyst. Okay.
PET CT. There's an enhancing mass in the right kind of paraspinal region with increased uptake on the PET images. MR images demonstrate internal kind of, there's those hypointense foci, and then the ultrasound with increased flow. Nope, wouldn't have guessed that.
It's been an inflammatory pseudotumor. Okay. Eric?
Dr. Cruz, what else would be in the differential for something like that?
Something like this. Well, this I would certainly think a schwannoma would be in the differential, especially with that low signal intensity centrally there along the course. And then sarcoma, MFH, especially in an older individual, I would certainly put in the differential here. And fibrous tumors you can have in this area.
17-year-old female, right paraspinal mass, sort of complex with possibly some fluid fill, but also some solid areas and similar
some,
complex.
A little bit of flow in it.
Mass.
Yep.
Yeah, there's some flow heterogeneous on MRI, possibly with some enhancements. It's in the soft tissues. Could be something. It could be another granulomatous type reaction, but it could certainly be a tumor and
Yeah, hard to
soft
see
tissue
there.
mass of some kind.
If we go back before, yeah, there could be, maybe this is flow or calcium. I'd certainly like to get an X-ray or a CT of this. And here it looks like there may be vessels in it. So it could either be a very vascular sarcoma, but the edges are kind of irregular, kind of scalloped. Maybe there's a vessel coming in here. It was removed and turned out to be a hemangioma. But again, I would be very concerned about a malignant sarcoma, yeah, even with those other findings. So those are just some kind of show and tell, some masses around the lumbar spine. Next week, when we meet again, I'll show some bone masses around the lumbar spine, and we can go through those. Any questions? Yeah. Okay. Yes. All right. I'll see everybody next week.
Thanks, Dr. Cruz.
Yep.
Thanks, sir.
Thanks.